I'm so excited to be able to kick off the 2023 Mental Health Equity and Liberation Summit. This is an extremely important topic and something that I'm especially passionate about. The theme of this event was politics and mental health disparities. So not only did we have researchers and advocates, community organizers and activists, we had a lot of elected officials here to talk about policy and talk about what the community can do to support them in their efforts in creating more avenues for mental health care access.
Collective action is necessary. And sometimes we think about the systems that we need to change, but we don't think about the people that make up the systems that need to change. And you are the people that make up the systems that need to change. And here's where it starts.
These are the types of events and activities that are very important. They nurture our soul. They make us better clinicians. They sharpen our intuition and our capacity to do the work. And they also give us a break to be able to nurture our professional and personal development.
The reason that we have challenges when it comes to funding is because of the lack of understanding when it comes to the mental health needs in the state of Alabama and in this country.
Oftentimes when we're talking about mental health, we are talking about programmatic interventions related to direct access to care. For us, that looks like offering free mental health counseling. But we also know that while that work is impactful, especially in regards to the direct impacts of individuals, that the long-standing work is going to require policy and political intervention. This is why we chose the theme of politics and mental health care advocacy, because now we are working in the space of policy. We're coordinating and partnering with elected officials, with entities, and we're really creating opportunities to bring about long-standing change, because while direct services are important, they're oftentimes a band-aid on a larger issue related to mental health disparities and lack of access, and we're looking to address that.
The issues of mental health, we need to continue to bring awareness, and then we need to continue to usher resources collectively at every level to make sure every generation has the resources they need, because today that does not exist.
We got a lot of people who are hurt, who need to be healed, who are traumatized, and they don't know where to turn, and dysfunction has become normal. So now we can usher in a piece where it's okay to be in healing. It's okay to get restored.
When we think about some of the mental health issues that we are experiencing, especially in communities of color, it's directly related to not having access to education, not having access to specific resources. One of the things that we have to learn to do as clinicians is figure out how we can advocate to change policy specifically surrounding those things in our community.
I think mental health touches everybody, regardless of whether or not we're talking about it or not.
Seeing a room full of Black clinicians who are pursuing this work was just totally awesome to me. And just really being able to express the barriers of that work. We need spaces where we can have our authentic conversations without people being offended, without people tracking it back to racism. The work still needs to be done, but it's working.
The Mental Health Equity and Liberation Summit seeks to be intentional about knocking down those barriers of mental health, but also bringing care to the communities.
My hope is the recognition that this will feed out into the community so that people can be aware that it's not a shameful thing to admit to having some mental health needs. It's all about people telling their story and being open about what they've experienced and able to get through it.
I'm just so proud of the work that the Black Women's Mental Health Institute is doing in the community. And thank you so much for advocating on behalf of Black women such as myself to be the change that you want to see.
If you really want to be able to get a learning experience that is going to accelerate the way that you think about this summit is a summit to be at.
These women are phenomenal, and I think they need to be supported more.
This was just a launching point for us to really do this work on a much larger scale.
She's doing something really powerful here, y'all. Help her, support her, nurture her, right? Because this is what helps us grow and to change systems. Thank you, everybody.